The next thing we're going to go over is how to prepare the manifold, which is a device that allows the physician to measure the pressure in the artery and then pull also saline and contrast through the same port. So the manifold is in the bottom left corner right now. This is how you're going to get it. It's not going to have your transducer, which is your pressure monitor, or your contrast hooked up, so it's something you have to take care of. The first thing I do is always turn the saline and contrast lines off so that I don't accidentally push saline into those lines. Next, you're going to take your contrast and hook it in to the port on the far right. Next, you take your transducer, which goes on the far left. As you can tell, my wires are a little bit crossed. Yours will come with nice plastic wrapping on them, so they're not going to be like that. Screw that on. And then most physicians with the middle line prefer to use the MLRA, which allows them to have access to both the saline and the waste. So that's the small device right there. You're going to screw that on. And then instead of hooking the same line back up, you hook it to the area that has the split, as you can see there, which will allow them to pull saline and then also push waste without having to unhook anything. If you do that, always remember to take your end of the saline line, which will be that right there, and put a stopcock on it, because otherwise saline will flow freely through that line. And then always turn it off so that saline doesn't flow. Make sure that all your ports are tight before you push any saline. And then the first thing you're going to do to prepare it is flush through your transducer, which is your pressure monitor. Again, yours will be better organized than this, hopefully. So the first thing is the side port. That gauge right there that I just turned is off. So right now it's off to the end part, and you can see that saline came through the side. Turn it off while you're pushing saline, and then the same thing with this transducer. Push saline and turn it off. You can also tap it against the bowl while you do that, just to make sure you don't have any air bubbles right there in that area, because that can lead to improper pressure readings. Always make sure to turn it on to pressure, which is turning it down. And that's how you prep the manifold. You can also pre-prepare your saline line. I personally don't. People will do it differently. And you can also hook up extension tubing if you wish. After the patient has been prepared for the procedure and the sterile drape is on the patient, you can then hand off the end of your transducer and saline and contrast lines so that they can be hooked up to the bags and to the pressure monitors. So the first thing you're going to do is hand off your transducer. So you're going to hand the white end, again making sure that your lines are unkinked. Hand that off. And then take your contrast line, which has the green ball in it, and your saline line, and hand those off. Then you can prepare those lines. The first one I do is the saline line, so you're going to turn that up, which means flow is coming that way. Pull out until air is no longer flowing, and then turn off. Because you have the MLRA, you can also leave that on and push into it into your waste bag if you want. You can also pre-prepare saline. Most physicians prefer you do a mixture of half and half. So use your saline, which has the white label. Screw that on. And the one on the far right is your saline, so turn that up. I pull 15 of saline and 15 of contrast. Obviously, I'm not hooked up to anything, so nothing is pulling, but that's how it would work. Set that off to your back table, and then control syringe will go on. So turn it up to saline, pull, and then turn it up, tap the side of it, and push so you don't have any air in it. And you're going to do that a couple times just to get all the air out of that syringe that you can. Turn that off, and everything's ready.